Sushma madam, good evening.
Very good evening, Samir bhai. Very good evening. Madam, good evening, ma'am.
Good evening. So welcome, Sushma.
Yeah, I'm very happy to see you, ma'am.
Yeah, thank you. Hello, Shamik. How are you? Piali
I'm
has
fine,
joined.
ma'am. Sorry, I was muted. Very good evening to you, ma'am.
Has Piali joined?
Yali, I think. Dr. Samik, can you please call her?
Just call her. She has just says join. She is joining.
Oh, okay, okay.
Hello, Swati ma'am.
Hi. You're just waiting for you.
I'm there, ma'am.
Yeah. I was just putting a.
Can we start, ma'am?
Yeah.
So, dear friends, very good evening and welcome to the one of the very important webinar series what we are going to start today. So, before we start the official presentation, I requesting our Executive Director, Dr. Swati Bhawa madam, to welcome you all.
Yeah. So welcome everybody for this public education webinar. And I'm more delighted that we have the chairman of AHA, Dr. Sushma Desai, the secretary AHA, Shami Ghosh, and the chairman-elect Piali Bhattacharya. As you all know that AHA is my first baby, founded in 2000, and Aki is my second baby, founded in 2007. So I'm very happy to see both these babies come together. And Sushma and Samir will be giving you briefs about how we are going to collaborate on LSE together. But on behalf of Aki and the whole family, I welcome Sushma, Shamik, and Piali.
Honored,
ma'am.
ma'am.
Very, very
Honored.
honored, ma'am.
My pleasure.
Okay. So, before we start it further, I requesting our guest of honor, Dr. Sushma Desai ma'am, to give us some inaugural notes.
Very good evening, respected, beloved Dr. Swati Bhave, madam. Dr. Piali, madam, the chairperson-elect of AHA, Dr. Shamik, Dr. Samir Bhai, one of the teammates, and a very, very important integral part of both the babies of MAM, and Dr. Sandeep, Dr. Prashant, and all the members who have joined today. It's not only a pleasure, but a great honor for the AHA and for my team and myself particularly to collaborate. Even collaboration is a small word, I would say, under the leadership of respected Dr. Swati Bhawa madam, do some programs which are iconically being designed and being propagated by none other than Dr. Swati Bhawa madam. And it's an honor to have this program under Dr. Swati Bhawa madam's leadership in AHA in collaboration with Aki. So Aki is our sister and AHA's sister, and both the associations working together is a dream. And it was always like for me to do something under madam's leadership. And I'm so very privileged. I feel truly privileged and honored that madam has, is doing now, becoming active gradually, and we will be having a great blessings from her to have this program started. So Dr. Samir Bhai is the national coordinator of this program, and I will request Dr. Samir Bhai to please give some brief regarding the programs which is being designed for the permission of Dr. Swati Bhawa madam to be conducted under AHA in collaboration with Aki under the leadership of madam. So, Samir Bhai, I would request you to please narrate or brief the idea of that program and the detailed program and the detail, everything will be after we will discuss with Dr. Swati Bhawa madam and the team. We will be having that officially declared. So, Samir Bhai, just brief idea And before that, I'm thankful to my team, Dr. Shamik Ghosh, the Secretary HA, and the President-elect, Dr. Piali Madam, for being with us today. Thank you so much, ma'am, with due regards and respectful regards, ma'am, and pranam to you. Thank you, ma'am.
Thank you,
Samir
madam.
bhai?
Thank you, madam. Now I requesting our second guest, Dr. Piali Bhattacharya, madam, to give some welcome note.
Thank you, Samir bhai. My pranam to Madam. She's been our mentor. She's been like a mother figure for all of us. And it is today a big privilege to be collaborating with her in Aki. So, as she said, both her babies prosper. That is what ma'am is so happy about. I can see the smile on her face. And I remember one song which I had heard in my childhood and now too. Ek se bhale do, do se bhale char. So, a collaboration always builds up what is best in both of the babies. So, ma'am, thank you so much. It is such a privilege to be here.
Thank you, Piali.
Thank you, Piali, madam. And over to Dr. Samik Ghosh, sir.
A very, very good evening, and my extremely humble and respectful regards to Professor Swati Bhave. Uh, Unknowingly, she has touched the lives of every pediatrician who has been practicing adolescent pediatrics. We have revered her, we have looked up to you, and we will continue to learn from you, ma'am. And it is an extreme honor and privilege for all of us to be associated with Aki in this manner. We look forward to a very, very enriching experience. Thank you so much, ma'am.
Thank you, Shamik.
Thank you.
Now I requested the Dr. Swati Bhave, madam, to give an overview about the Aki's work of the life skill education, and then I will give a brief about the more details in structured way. Ma'am.
Yeah. Thank you, Samir. Samir is going to give details of what are life skills and what are the programs of Aki which are done in life skills. I will just like to give you a small introduction that congratulations to those who have not heard of life skills before and have joined this webinar. Because one thing I can guarantee that once you learn life skills and start putting them into your practice, your life will be transformed. Your personality will change as you start using life skills in your day-to-day manner. As a president-elect in 1999, I first came to know about life skills, but it was only in 2001, after I relocated to Delhi because of my husband's transfer, I came in contact with Dr. Jitendra Nagpal, who ran an NGO called Expressions India. And he was a life skill expert, and he used to do regular programs in all the Delhi schools, CBSE and the DPS and all the other schools. And for over 5 years, I worked with him and did more than 1,000 workshops. And then I realized that life skills by WHO are meant only for teenagers 13 to 17 and school programs. But after having done so many, I wanted to do innovations of life skills, going far beyond that. And hence I worked with him to start a module, because normally life skills take 10 days, one session each. So like the era of T20 in 2008, when we launched Aki, we took out a model which is only 16 hours. So it can be done over 2 days, 8 hours each, or we can divide into 2 hourly, 4 hourly, 6 hourly sessions. And once having done this module, I realized that we can go for much older or younger population. So we did Aki for children from 8 to 12, and we also did it for college students from 18 to 21, and we also did it for postgraduates, Triple IT Hyderabad, from 24 to 30. And in every area, we found that life skill education was not only welcome, but we got a feedback that they have changed their life. Then I went beyond the students and I went to parents. So we started doing parenting life skills for parents. And then we found that we went to corporates. So I did life skills for Air India, BPCL, Bird Group and all. So now Aki has this expertise of doing life skills in a large number of population. And hence, here now we started that if you want to have adolescents benefit from life skills, we don't stop at adolescents. We also teach the adolescent stakeholders. And these stakeholders are adolescent experts, pediatricians, all the physicians like gynecology, psychiatry, mental health professionals who are dealing with adolescents, sports counselors, parents. Then if they also imbibe the life skills, they can approach the adolescents in their care whether it is their children at home, whether it's a patient as a physician, whether it's a coach having sports or other coaches, or whether it's teachers in schools and colleges, we can carry the benefit to the adolescents much, much more if we also involve the adolescent stakeholders. And that has been Aki's work for the last so many years. And Samir will explain all the things. But AHA is a much bigger body, and collaborating with AHA for life skills, I think we can really take it to the nook and corner of the country. And that is why I'm really looking forward to the AHA collaboration, where the numbers will be really great, because all of us then take it around the country. And of course, basically, I'm first part of AHA and then Aki, because it came much later. So I'm very happy at this collaboration. And I'm sure Samir, Shamik, Sushma, and Piali will all four do a wonderful collaboration. And we will take Aki LSC with AHA forward to many, many adolescents in the country. Thank you. And their parents.
Thank you, ma'am.
Thank you, madam, for the brief about the how the life skill education evolved in India by the your real efforts, and now we really go forward for the not life skill education only for the children and the adolescent, but it really needed for the our adults also, for our own selves also. And for that, just before we start today's session, I just give a brief introduction of the AKI, followed by the what the this webinar series is, and then we can go for the our first session regarding the overview of the life skill education, how it works, and how we can going to proceed for remaining coming episodes as the base on the AKI's life skill education session. Sharing my screen. I hope my screen is visible, right?
Right.
So we all know the AKI registered in 2007 and launched absolutely on the 2008, having its own four pillars, that is the teacher, parents, grandparents, and children and youth themselves. And our main aim is to do the all the activity that will be the our urban based activity, and that was actually implemented with our mission of the holistic health in the children and adolescent and young adult, with the promotion of the healthy lifestyle and the prevention of the lifestyle associated disease throughout the life skill approach. We also work with the all the pillars what just described with the help of the our volunteer. The list is including the different specialty doctors, mainly pediatricians, physicians of the all specialty and mental health professionals. We also having a different stakeholders as the our volunteers, that including the parents, teacher, educationalists, lawyer, sports physiotherapists, and research scientists also. Our mainly our work will be based on the urban base, with the help of the parent, teacher, and student in the school and colleges. This is the our different center throughout the our India, mainly having a four forum with one international forum, having a unique seven city center and five regional centers. And now we have also started the small city groups where the number is not adequate, but they want to do the activity of the AKI, like in the Chennai, Lucknow, and Bangalore. We have already started. Our board of directors, our honorary chairperson Dr. Yaswant Bhave sir, executive director Dr. Swati Bhave madam, and honorary secretary cum treasurer Mrs. Sarmila Lele. Myself with Dr. Samir Shah is the national coordinator. Along with we having a our ethical committee that led by the Dr. Anuradha Somani ma'am, and Dr. Surekha Joshi is the our research coordinator. Our social media presence are mainly on our website at www.aki.in and akitrainingsprogram.com. We also have our own Facebook page, YouTube link, and Instagram page. Coming to the different Aki training programs specifically related to the life skill education, we having a master training workshop on WHO. Mainly, we do the work that will be beyond the 30 to 70 years, but now also added what the madam says from 6 to 12 years and 18 to 25. We have a life skill education for the parents, teacher, the patient support group, and corporate and executive. Research proved that the AKI ethical committee that multi-centric youth behavioral survey that is really motivate us to do the more and more such surveys on base of the life skill education. Medical checkup and the screening can be done along with the life skill questionnaire, and at the same time we targeting the life skill behavioral change by the life skill education. In COVID, this is a thing where the livestock and we all are on the digital media. We had evolved by the digital education of the life skill education and conducted a 9 series of the webinar to complete the whole life skill education in that. And that was really appreciated by all because it was the era where people was really looking for such type of the activity that will really help in their regular day-to-day life in stressful conditions. We are also having an internationally conducted a workshop on life skill education in the 12th World Congress of the International Adolescent Health Association in Global Minute that occurs at the Peru, and it was the virtual modality of almost 3 hours workshop that what we have conducted and very well appreciated by all who had attended. We also did a unique poll survey in 2022 with the targeted student of the SVT College Mumbai having an orientation. We did the pre-polling before the orientation presentation, and then we can do the again the post-polling to reassess the knowledge and view how it improves. And we also did the impact analysis how it will really helpful. Even we are doing the life skill education online also. So this is the our unique survey that we had did in the 2022. And since the last December 2025, we developed a online certificate orientation course of the on life skill education, and that was we had completed almost the 3 batches up, and that will all having a 80 to 90 students per batch, and that more almost we had given it 20 to 50 educators. We had get the orientation to life skill with the help of this digital platform. After that, we had having a master trainer offline course at Pune between 25th and 26th of the April, and that was a 2 full day course in which we had actually trained to the our old train oriented to the life skill education almost 100 participants in such a way that they can now implement this education to the different modality at the community level in school, community, and other places. With this consideration, now we had coming with a webinar series that is the preventive prescription of life skill approach for the building resilience in children with life skill for the life, building resilience, and ultimately empowering the adolescent and young minds. And we can solve the different issues related to their regular day-to-day problem. This year, the Aki celebrates Aki Week between the 17 to 24 July 2026. Since 2022, we are regularly celebrating this Aki Week, and that was the thing. We also again with the theme again of the same that prevention reception, the life skill approach for building resilience in children and adolescents. So I requesting the each and every participants today who has joined today to join us with this celebration between 17 to 24th July. We looking for the collaboration of the our Adolescent Health Academy of IAP in this week celebration, and we can plan the educational webinar along with the social activity that is in the school and community based activity also with the life skill education theme. So now let's come to what is this webinar series and what we are planning here. Our main we know that life skill having a totally 3 components in the head, having thinking clearly, feel deeply by heart, and then act responsibly by the hand life skills. So this webinar series having we are planned every alternate Friday, means first and third Friday of the month, We directly do the life skill based approach for the building the resilience in children and adolescents. If we check what this webinar series is, we all know so many daily challenges in adolescents' life. That would including the academic stress, social media and digital media addiction, peer pressure and substance abuse, emotional difficulties, parents and adolescent conflict, career confusion, bullying and relationship issues, and gender identity concern. So we are planning to take all these type of the scenario that what we really implement in regular day-to-day practice once we learn how to approach it. And our main important is to how the intervention occur after the problem becomes serious is not the aim, but our important is to build the life skill before the problem arises and that becomes the more crisis. And that's why we are describing it as a preventive prescription rather than the conflict solving after the problem arises. Our aim of this is to the life skill education as a preventive and practical approach for addressing the emotional, behavioral, and social and developmental challenges that is faced by the children and adolescents. Our objective of that ultimately participant will learn, identify the common adolescent issues, recognize the which life skills are deficient, understand the stakeholders' role where they have to use this, apply the practical life skill solution not by the adolescent but its stakeholders, and building the resilience and emotional well-being and strengthen the communication and relationship, and ultimately creating supportive home, school, and community environment by the help of the life skill education. How we going to conduct that series? So our this will be the case-based panel discussion model of almost 60 minutes and more. Here our lead moderator will be our master trainers, myself, Dr. Prasant Karya and Dr. Sandeep Kavre will be the moderating this session. Our panelists will be the Aki life skill trained volunteers. We are going to invite from the different part of the country to solve the different category of the problem, and that will ultimately help the parents, teachers, adolescent and young adults, and medical professionals. Our discussion framework mainly focus into the identifying the problem, identifying the missing life skill, understand the stakeholders' role, apply the life skill based solution, and ultimately build the resilience and positive outcome not only for the adolescent but the whole family. Our focus mainly will be prevention, early intervention, and practical solution. We are not focusing on the intensive psychotherapy, detailed psychiatric management, and clinical treatment protocols. So, what is the life skill approach of AKI? We are mainly considering the problem with the what the life skill missing here, rather than the what is wrong in with the child or the what is wrong in the child. Our 10 core life skill what we are dividing into the head, heart, and hand. And today we will just learn how and which they are. And ultimately, our expected outcome will be the skilled mind, resilient heart, and responsible action. And life skills are not merely lesson to be taught, but they are tool for the life to be practiced in every day-to-day life, and that is our main motto of Aki, that is building the resilience on skill at a time. So with this basic introduction, how we are going to conduct this webinar series in throughout of coming months, let's begin our first session. And always we are starting the all the things with the our lamp lightning by requesting this Swati madam and the all the guests to please allow me for the lamp lightning and official inauguration of today this webinar series. Madam, can I we can go for lamp lightning?
Please go ahead, Samir.
Yeah, sure.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः.
So with this divine lamp lightning, we are starting our first session, that is on orientation of life skill. Today we having demonstrated what are the different life skill and how it will be the helpful in making the different decision in daily day-to-day life of the adolescents problem. This is today the just presentation of the overview, and then from the next webinar we will start to practically implement the life skill. And for today, we having a Dr. Swati Bhai, madam, our own expert, and we three people will going to be speak about the different methodology of life skill. Just brief introduction, Dr. Swati Bhai, madam. We all know in detail, so it's a very huge biodata that what we have to describe. If Dr. Swati Bhai, madam, we want to introduce. Myself, Dr. Samir Shah from the Vadodara, and also having a national coordinator of the AKI since 2019. Dr. Prasant Karya, our youth wing in charge of National Forum, and Dr. Prasant Sandeep Kavde is the parent forum in charge from the Pune. We really looking forward the 17 to 24th July as Aki Week celebration with the collaboration of the AHA just we mentioned between the by the Dr. Swati Bhai madam and Dr. Sushma Desai madam, and let's hope we can create a history to get a good result of the community activity and along with the learning experience for the pediatrician and all the stakeholders. So let's start and begin our first session of the today about the overview of an introduction of the life skill. Over to Prasant.
Yeah, thank you so much. Samirva, you will continue sharing?
Yes.
So it is an honor and
My screen is visible, right?
Yeah. At present, not. So it is an honor and privilege to work with ma'am, and it's a great moment that Aki and AHA are collaborating. The screen is still not visible.
Okay. Now visible? Prasant,
Yes,
screen is
Samir,
visible now?
visible.
Okay.
Yeah, it is visible. So once again, it's an honor and privilege to work with Swati Bhave ma'am under her guidance, and it's a good thing that Aki and AHA are now collaborating on life skills. The disclaimer which we say is these lectures are for the educational purpose only, for awareness within the community of adolescent health without any commercial intention or purpose, and images are used to make it more interesting for teens, and we ask all contributors to use image for open source platforms wherever possible, and Aki has no intent of any copyright violation. Please do not take pictures and circulate the slides or use for commercial purposes. Coming to the 10 WHO life skills, which are there in a session on orientations of a life skills, then there are 10 life skills: self-awareness, empathy, coping with stress, emotions, creative thinking, critical thinking, interpersonal relationships, effective communication, decision making, and problem solving. The concept and the origin of life skill was having an early foundation by the psychological theories of Erikson and Kohlberg laid the groundwork foundation, but Dr. Gilbert Botman in 1980s developed a highly effective life skills training program to prevent substance abuse, focusing on assertiveness, decision making, and creative thinking. As I said, WHO is giving 10 core life skills, and UNICEF is also promoting a comprehensive life skills framework emphasizing empowerment and active citizenship. Respected Dr. R. Parthasarathy was considered as the father of LSC in India for his work at NIMHANS, who adopted WHO skills. The key benefits are, WHO says each and every word is important, that life skills are the ability for adaptive and positive behavior that enable individual to deal effectively with the demands and challenges of everyday life. And that is the most important thing. And that promotes the mental well-being, builds the competence and everything. Even UNICEF says there is knowledge, attitude, skills, which is there, and it is a behavior change And this behavior change development approach is designed to address a balance of three areas. Again, a knowledge, attitude, and a skills. As I already said, WHO has said 10 life skills which are there, and this life skills is actually divided according and paired actually. One life skill is there in hand, heart, and head skills, which we will be discussing. But when we say thinking skills, it is self-awareness and creative or critical thinking, problem solving and planning and goal management, or social skills in form of interpersonal relation and communications, cooperation and teamwork, and empathy. And a negotiation skills will be in form of managing your emotions and feelings, resisting peer pressure and family pressure, assertiveness skills, and advocacy skills. So adolescent is a period in which everything is happening all at a one. What we see is a physical development, the physical changes which are happening. But along with this effect, there is a psychological changes which are happening. There is social maturation. There is educational development. The neuroscience of vulnerability in adolescent is there, and the well-known two theories, a rational center and an emotional center. When we say a rational center, that is a prefrontal cortex which is there and it is still under construction, and that's why we say it is a road under construction. It is responsible for the logic, planning, and the impulse control, and it's still developing. Sometimes it takes 20 to 25 years. While in adolescent, the emotional centers or the amygdala, which is very fast, it develops early, they are very reactive, sensitive to peer influence, and prone to the amygdala hijack, which is there. So, in adolescent, if we talk about the universal features, there is the onset of puberty, which brings a biological change. We see increase in next is increase in weight and height, along with the all physical changes which are happening. But there is again a advanced abilities, like they do now have a cognitive change. They can think, they can give reasons. Everything has been there. They do have their own self-image. They do have thinking about the relations. Sometimes they do have emotional changes which are happening, and they do have a new roles in the society. So, if we say, again, rightly said by our WHO, that life skills are the ability of a adaptive and positive behavior that enables individuals to deal effectively with the demands and challenges of everyday life. That means this adolescents will have adaptive behavior and a positive behavior that will be required for a bridging a transition from childhood to adulthood. And during this critical process, if they deal it effectively with the demands and challenges, then their road will be very smooth. Now, these adolescents are having many stressors. They do have academic demands, like tomorrow there is an exam, and because of that, there is a stress. There is a fear of a failure. They do have expectations from the family, society, teachers, and everybody. Even their interpersonal dynamics, like the relation with the peer, matters the more. They do come under a negative and a positive peer pressure both, and there is a fear of a rejection also. A self perception is most important, like the body image, physical changes which are happening is giving sometimes them a problem, and their internal dialogue that actually makes issues. When we see the adolescents, there are underdeveloped life skills in adolescence. There is an anxiety from academic and social pressures. What if I fails? And we have seen so many mental health issues which are occurring because of this social pressures. They do have a conflict and fractured relationships. They can be a transient or that can be a disturbing to them. And a peer pressure leading to a high risk behaviors in form of a substance abuse or a risky behavior is problematic. Hence, many adolescents and young people face problems of remaining healthy or well adjusted. They are having a sometimes a poor self-esteem, or sometimes they are not able to withhold the peer pressure negatively, and that can lead to body image issues, unsafe or too early sexual activities, unwanted teen pregnancy or unsafe abortions, HIV and other STDs, even substance abuse and drunken driving can happen. They may have violence and aggression, and adolescents in rural areas are deprived of adequate and appropriate opportunities for education and other issues, and there can be a gender discrimination. So, when we teach them the life skill, that is the key, that when we are investing in adolescent life skills, it gives a triple dividend. How triple dividend? Their health will be better today, their health will be better in future, and better health for the next generation will also be there. So this is most important. So whenever a clinician is becoming as a life coach, they must give 5-minute OPD consultation regarding this life skills, which should be a quick and targeted questions. The home environment should be checked and the school and community should be checked. Then they are in a unique position of a trust. Life skills can be taught in a brief impact intervention, which woven into their existing system. So moving forward, I hand over to Dr. Samisha. Hello.
Yes, sir.
Yeah.
So now we all understand what the different life skills are and how it will be really helpful in a different systematic way. We want to understand it in a more detail. We have to understand its lucidity, and that's what we are divided the life skill into the macro architecture of the head, heart and hand, and always we think the heart should come first, and that's why we are usually start the our own life skill education with the heart life skill, that is the coping with emotion, coping with stress, self-awareness, empathy, and it's ultimately really give us the internal and external feedback loop and regulating the nervous system. Then we will understand what are the hand life skills, that including the effective communication and interpersonal relationship, and followed by the head, that is the cognitive life skills like the critical and creative thinking, problem solving, and decision making, and rationalized analysis. So core insight of the life skill is to the it's there is a no life skill operates in the isolation. It always has a effective communication of the hand life skill, followed by the emotional regulation by heart, and ultimately head has a proper structured thinking that will give a life final shaping of the life skill education that help a lot to immediately go for the action. Let's go for deep about the what are the different life skills really help us. In heart, it coming then cooling down the amygdala, and that's why it is very important. Like the self-awareness is like a mirror. It identifies the internal triggers, its strengthens and flows, and absolutely prerequisite for the all other life skills. Coping with emotion and stress are considered a seal of the our life skills and distinguishing the event from the reaction. It applying the regulatory technique and rather than letting the emotion distract the behavior. And finally, coming the empathy as a bridge, as shifting the focus outward toward from comprehended another's feeling without the moral judgment. In hand, the navigating the social system is the key, and that is the effective communication into together with the interpersonal relationship help us to mastering how the things are said, not just what is said, but its clear articulation and assertive with refusal. At the same time, building the and maintaining and occasionally ending the social bonding in a healthy, non-violent manner is that is about the interpersonal relationship. So ultimately, how the influence is, what is the mechanism, and how we solve the conflict, that will be discussed in hand life skills. Moving from the heart hand to the head, it really give a proper intuition to analysis. Creative and critical thinking give a suspending the judgment until the evidence is evaluated and shifting from the fixed mindset to the growth mindset that can't done to the I can't done yet. And this we go for a specific model and that will discuss in detail when we are discussing all the life skill in detail just in coming slides. So now, dear friends, paradigm is the shift. It is the deficit model that the general population-based issue to the targeted repair and fixing the pathology means you are not just teaching the curriculum, but you are archiving the human resilience in proper structured step-by-step manner rather directly going and advising just only about the life skills. So we all know the navigating the life skill in adolescence are crossroads. So problem and decision paralysis is always there because of their own mind blocking. But the bridging the critical and creative thinking with the short analysis of the self-awareness always help the child to utilize this life skill in proper systematic way, and that is what our goal of this webinar series. So over to Sandeep to give the details about the hard life skills.
Thank you very much, Samitji. And thank you, AHA and Aki, for this opportunity to interact with all of you. When we talk about life skills, you have to understand youth now have access to lots of information, but what they don't have is ability to translate that information into actionable things. And that is where life skill training comes in place. Self-awareness is the most important skill a person can have. Our recognition of ourselves, of our character, our strength, our weaknesses, what I like, what I don't like, is very important to take life decisions. Being aware of what my good points I have as an adolescent helps in increasing my self-esteem and self-confidence. This also helps me to understand which opportunities I should take and which I should avoid. This is a life skill which needs to be taught not only to adolescents but even many times adults. Next, what happens is we have seen many people who do not have any lack of resources, maybe wealth, but even then they are unhappy and dissatisfied with their life. This is many times a gap between what is their real self and what is the ideal self which they look at. This malalignment causes unhappiness and severe burnout, and we keep on chasing dreams and things which may we not require, but we think may be accepted by the society. Teens are forming their identity. If we give this self-awareness to these teens, they cultivate, it becomes an inner anchor, and they resist external pressures and negative peer pressures, which can push them to wrong directions. Next. Next, please. So, what we need to teach adolescents is how to do the self-awareness skills. Simple techniques like SWOT analysis, where internal strengths and weaknesses can be done, how to capitalize on those strengths, how to either hide your weaknesses or work on them so that they do not become a roadblock to you, how to understand whether the things which are in front of me are opportunities or they are risks. If I differentiate from between them, I can take correct choices. There are many dimensions of self. What is my image in front of others? What is my inner thoughts? How do I talk with myself? What is my perception of my physical self? So what we need to know is a person cannot manage what he does not know. So understanding yourself is the first step of helping to managing them their own thing. When we go ahead, we see lots of problems in this world can be solved by simple understanding of each other. Ability to imagine what life is like for the another person will solve many of these problems which are going on in this society. By putting oneself in other person's shoes gives us an unique ability to understand and many times helps in acceptance. If we can improve this empathy skill, world will nearly be a better place. What we have to tell them is the difference between just showing of sympathy and the differentiation between empathy. Because all of us, when we do go through our social media, any post, any problem, anything, we just put like, we just comment, we just give 2 words, and we feel that we have done our thing. That is just sympathy, just a feeling for someone, pitying or sharing, and taking a higher position. Whereas empathy is feeling with someone. It is not judgmental. Here, we both are equal. Empathy encourages positive and nurturing behavior, improves social interactions, especially in the new multicultural world, and it fosters tolerance so that problems in the society at a large can come down. What we have to understand that empathy is a two-way street. that drives constructive action. If there is empathy, many conflicts do not arise, or if they arise, can be solved in a win-win way. What we have to understand it requires a combination of both cognitive processing, that is understanding why the person is doing that action, what the motive of that person is. At the same time, having a middle ear of heart where we understand it is not every time I should have my say. Sometimes we have to share. This gives an objective stance. It gives an instinct. Instead of criticism, let us accept and see where we can improve. And it is just not moral posturing, but helping each other, and which here creates a beautiful and better world. Next slide, please. So, what we have to understand, a person who is not confident in his own self cannot help others. So, when you have a good high self awareness, you know what you want, and you have a very good empathy, the society and the person in the society becomes resilient and cohesive. They are emotionally regulated, culturally accepting, and capable of integrative negotiation. That is win-win. When you have very high self-awareness, but you don't care, you don't have empathy, you become arrogant and disconnected. You are confident, but you think my way or highway. When you have poor self-awareness and low empathy, you are isolated, you are reactive. Everything becomes a trigger. You think that every comment in this world is targeting you, you are negative, and this creates poor communication, and you are always in conflict, even with people who love you. If you have very high empathy but very poor self awareness, you become a people pleaser. You don't understand when you are being taken for a ride, and you lack boundaries and it becomes anxious. So having good self-awareness and good empathy is the key for the individual to prosper. And when we can do it for the society at a large, it helps the society to prosper. When we are going through our walks of life, next slide, please. When you're going through our different walks of life, stress and emotions are daily given. We all go through periods of change in external challenges. Understanding and recognizing emotions within us and others will help us. Recognizing what are the sources of stress, why I'm feeling discomforted, understanding how they are affecting me, and acting in a way will help the adolescent to deal better. In this way, you don't just react to situations, but you respond to situations in a better way. Next slide, please. Emotions are barometer. We all go through the cycle of anger, joy, happiness, calmness daily in our lives. Adolescents seem to be having this scale to the maximum. Their emotions seem to be very intense, short acting, but pushing them to do something. So you will see your adolescent suddenly burst into emotional anger, maybe fit, or just get silent, or sometimes cry for a small casual thing. What we have to teach them is they have to understand what emotion they are having, recognize the intensity, and then you regulate the expression of that emotion. We give in our programs with adolescent examples how anger can be constructive. So it is not that the label the emotions, understand their intensity, and avoid the health impact. There are different ways which we can do this. Breathing, grounding, composing yourself, journaling. You have to manage our emotions. You have not only let the emotions manage us and push us to directions we do not want. Even in today's as adults we face कि अरे गुस्से में बोल दिया, but we have to understand, can we deal with that situation better and help our adolescents who are yet in the amygdala trap to also regulate and give their emotions better. So we all have discussed, Prashant sir has already discussed how, because of the lack of development of prefrontal cortex, the hypothalamus and amygdala are over thriving or over powering the thinking cortex and brain. So emotional stimulus gives a reactive emotional response. Many times the reaction is disproportionate to the trigger because there is no filter of the prefrontal cortex. Many times, if you ask the adolescent in cool mind, how would you react to a situation? And they can give you a coherent, correct answer step by step. But when they are in that situation, actually, they make wrong choices. So, what they have to do is identify, know themselves. How am I feeling? And this is known as emotional literacy. Then, when they are doing, what kind of feeling is this? Is this healthy? Okay. If this is not healthy, how what I can deal with it? Oh no, sometimes it is so overpowering that I cannot deal with the intensity. So, what should I do? Reframing, that is using thinking. Okay, I have a problem, but can this problem be solved? If this problem cannot be solved sometimes, are there other options where I don't have to face? So, thinking, reframing the situation, and using optimism will help. And then act, giving yourself control bec- and doing an action after thinking thoroughly about your emotions. This loop of navigation will help them go through different ups and upheavals of life. Next slide, please. So, what do you have to do is understand immediate reaction is usually short acting and it is intense, like an emotion which you're feeling. The mind will many times tell you, try to make you aware, but what you have to do, give it pause. Your mind will then, in that pause, calm the emotion and tell you what is exactly to be done. Here we identify, we label, I'm angry right now. So you know when you are angry, I should not take any rash decision. So identify the emotion, think, and then there are different techniques which we teach adolescents. There are simple short techniques in heat of the moment, the reverse counting, breathing. Whereas when the emotions are chronic, consistent, we have to do long-term techniques like visual imagery, then progressive muscle relaxation. So we have to tell them different ways. Short techniques for short periods where it may be not available. But even chronic emotions, chronic low states have to be dealt with regular practice of progressive muscle relaxation. So if we give our adolescents and we help them practice them when the adolescents are in a cool state, when they are normal, it will help them to react better. Emotional literacy, what we have to teach is there are two types of triangle. When there is a problem in life, I am in the pessimistic triangle. What I think is whatever this problem is, it is going to be permanent. मैं आज फेल हो गया, मैं हमेशा फेल होऊंगा. इट इज परवेजिव. मैं पढ़ाई में फेल हो गया, मैं लाइफ में हर चीज में फेल हो जाऊंगा. पावरलेसनेस, मैं अभी पास नहीं कुछ कर पा रहा हूँ, लाइफ में मैं कुछ कर नहीं पाऊंगा. सो दिस इज परमानेंस, परवेजिव एंड पावरलेसनेस ट्रायंगल which is very very difficult to break. This cognitive reframing we have to teach our adolescents. It's okay, I failed, but if I practice again, I can pass. So they will understand problem is temporary. Okay, this time my efforts are probably low, can I increase my efforts? Then I will try different ways to tackle the problem. Or I will recognize, okay, dancing is not my cup of tea, but other skills I do have. So let us focus on them. So I understand my failure is isolated, just this subject, not everything. So if I can break my pessimistic triangle to an optimistic shift, optimistic triangle, I can win and go and explore different things. We have to teach this emotional skills to adolescents. So when the child is comes to our OPD, can we ask what will happens when you are angry? What changes do you happen? So that the child starts to focus. Ki, okay, my heart rate increases, my muscles clench, my posture changes, my face changes, my tone of voice changes. So if I can regulate all of this, can I deal with anger better? Then in the house, can we create a calm corner? What we usually do is sit out or we give them time breaks as punishment. Instead of punishment, when we are emotionally high, can we make a cool, calm corner with their loved things, books which give them comfort? When the teen goes, when they are overwhelmed, and try and focus and come back again. In school curriculum, can we integrate short mindfulness breaks like yoga or brain breaks like puzzle challenges or thinking the way where they can come back to their normal emotions. And then, similar to emotions, Stress is something which we all go through life. With advent of social media, with exam pressures, teenagers are also going through lots and lots of stress. हमें लगता है उनके जीवन में क्या है, but if you ask them, they will also show all signs of stress. What we have to understand, stress is not something which can be avoided. Stress is a normal biological response to stimulus or challenges. When it is very low stress, we are not very keen to give our best performance. But as we are increasing, trying to give our best, but the challenge becomes so overwhelming that in spite of our best efforts, we are not able to cope up. It becomes distress, anxiety, burnout, panic. Balance, being in the eustress environment where it gives you motivation, but it does not cause any burnout, but it is a positive challenge for you, is the best period of stress which you have to understand. So, understanding when I am in the zone where this is eustress, where it is become distress, I have to understand this is stress management and it is perfected only by practice. Next. So, we give this simple response to adolescents. Just imagine you are in the jungle and you see a tiger. What will be your response? Obviously, I will freeze. I will fight. Oh no, I can't speak anything. I will just yell out. So adolescent will give all they will tell the responses. And now we just reframe it. Okay, the tiger is 10 feet from you, but you are in the zoo in a cage. Oh, then I will be laughing with my friends. I will take the photo of this tiger. I will get a selfie with him. So perception of a problem dictates biological response. So like similar examples, we have to train adolescents. We have to distinguish real danger from paper tigers like exams. So exam is something which can be repeated. Why are you worried? What you have to worry is when you are on the road and you are doing unnecessary stunts on your bike. That is the more risky thing. Adolescents don't understand the difference, and we have to teach them by simple examples. Next slide. Next slide. Priya. So, as we discussed, we have to maintain ourselves in the eustress. We also are in our day-to-day work. We are doing thing and we are thinking that we are in eustress. Suddenly, when emergency comes in the OPD, we start to focus on it. Suddenly, a call comes from home, and the situation becomes challenging in a few minutes. This is distress, where it overloads capacity, breeds physical health crisis, causes decision paralysis. So even today, after so much planning, it happens in our day-to-day life. So for adolescent, it is very difficult to keep themselves in continuously eustress environment. So what we have to tell them, stress is unavoidable. The response is only variable. We can focus on variables which we can control. So what are the things an adolescent can control? Study schedule, sleep properly, hygiene, doing techniques which help them calm from the stress. And whenever it keeps overwhelming, asking a trusted adult for help will do. But what they are focusing on, anybody कि एग्जाम में डिफिकल्ट क्वेश्चन तो नहीं आएंगे. Oh no, my friends are studying, they'll score more than me. Oh no, the grade is बारह नीट तो वापस हो रही, और पापा क्या बोलेंगे. So all factors which are not in their control, this just increases the stress without helping or contributing anything to their performance. So we have to teach them, what are you worried about? Is it in your control? If it is not in your control, why are you focused on it? And teaching it, helping him do this control audit frequently will help them to manage stress. Next slide, please. When we have done with coping with emotions, stress, understand self awareness, what we have to do is now go to the world and connect with people. This is the skills which help us master interpersonal relationships and communication skills. So, what we think communication is how they speak, whether the grammar is correct, whether the voice and tone and fluency is good, or the vocabulary is good. But that is not just communication. Ability to express both verbally and non-verbally appropriate to the situation and culture without indulging in high risk behavior or succumbing to peer pressure is good communication. For good interpersonal relationship also, we have to be have an ability to express my opinions. So there may be my friends, but if I disagree with them, I have to be able to convey to them that disagreement in a respectful way, with a free way, without fear. If I have fear of some situation, I have to be able to tell other people around me so that they can help me. And if there is a need, I have to be able to ask advice to others in the time of crisis. This is effective communication. We teach adolescents that there are different communication styles. Next slide, please. What happens is, for adolescents, there is no focus on how they are communicating. In young age, they are doing it from enthusiasm. As they go into teenagers, with the change in posture, body language, build, sometimes that same style of speaking comes out as aggressive, domineering, and it causes conflicts. Whereas few adolescents go into their shell, try to avoid every situation, they keep mumbling, and they become passive. The balance of this is assertive. So, where we are respectful, but we also take responsibility, and this is the type of communication which creates more problem resolutions. We have to tell adolescents that words you speak are just 7% of communication. Your body language, tone of voice, how your eye contact, other things also make the whole personality and part of communication style. So unless you work on other skills, you'll always come out as maybe rude, arrogant, or uncaring to other people. So when we are improving our communication, we have to focus on all the aspects, and this can only happen by introspection and repeated practice. How you say something is often more important what you say. So what we teach adolescents during life skill sessions is we should have clarity of thought first, then clarity of messaging. We should be concise. What we are telling, which instead of abstract concept, can we do concrete, real examples? What we are telling, is it politically correct or an offensive statement? When I am speaking, I'm a considerate or of the feelings of others. If whatever I'm telling the instruction is the complete loop complete, or I have given half information, and while doing all of this, have I shown courtesy to the person in front of me? This will help in better communication. Everybody in this world craves for friends, family, people. That is, we all crave for love. But we have to be able to express this by empathy and good communication skills. When we do that, we have the ability to establish positive relationships. This helps in positive ways to interact with even strangers. This gives psychosocial support because ultimately, success is not about what we achieve alone, but what we achieve together. Being able to make and keep friendly relationships with friends, parents, and others is of great help. Adolescents make so many new relationships, as well as in this period relationship extinguish, because from school to college they are making new relationships, old relationships are going. From college they go to stay away from home, so the connectedness with parents decrease. So this is a relationship upheaval period, and adolescents with good interpersonal relationships will be able to navigate this period far better. Next slide, please. There are what we have seen with social media, with change in the cultural, this younger and younger children are getting into the language of crushes, romantic relationships, without understanding that what they are looking at in the television or in shows is not what they are experiencing. Many times, these relationships are small infatuations and transient. Even adolescents, what happens is their friends go to different places, schools, and separate from them. It is important for adolescents to learn the ability to handle, continue, or end relationships in a constructive way. That is, even when in separation, the relationship should end in a positive way. Many times we hear stories of revenge porn, injuries, acid throwing, just because a girl said no. This is just wrong interpersonal relationship and relationship going haywire because of poor handling. We have to understand that people grow into different individuals with time, and with positivity and maturity we have to handle and not go on the path of revenge. Interpersonal relationships comes on the values of respect, fairness, honesty, shared responsibility, non-threatening behavior, and building trust. When all these values come in relationship, we can go ahead in life. We trust people. When people have the ability to trust you, you also can trust others. And this trust gives us confidence to navigate life without challenges. Teaching how to make and maintain healthy relationship gives them a social safety net, so that even if they are staying away from their homes, they have a group of trusted peoples. What we teach adolescents is they have to be able to do the relationship audit, understand people who help them, have high trust, and they also feel worthy with them. Then there is a circle of acquaintances. That there are people around which we know, we talk to, we relate to, but that is not, we do not share everything which we know. And there are certain boundaries, and there are people who always violate these boundaries, and they sometimes can be said to be toxic relationships. So what we have to understand is trust has to be earned. We have to end toxic relationships constructively while connecting with people who are very important. When you are having a peer around you, you have to understand what values do you share with them, how you are connecting with them, whether it is just a psychological comfort which we are giving, or we trust each other, or it is just a relationship of transaction. We have to tell them that sometimes your classmates, teammates, or situations or tuition mates may be acquaintances, but what peers or influences you have to develop only people who share your core values. It is what we would understand is a peer will will try to influence you, because that is the nature of a social relationship. But whether to get influenced from those qualities is only possible if you are self-aware and understand what your own values are. So become self-aware and relate to values which respond to your own. In spite of this, there will always be, next slide please, there will always be people around who don't share those values, but we have to interact with them. At that time, we have to teach each adolescent refusal strategies. We teach in our workshops simple techniques like broken record, polite repetition, sorry, I cannot do it, sorry, okay, next time, but not today, cold shoulder, that is ignore. You're trolling, but I'm not interested. Go somewhere else. Turning the tables. So if two friends are telling to skip the class, you say, you gather others and tell them, look, these two people are bunking, let us stop them. It's not good. So learning to say no without losing social standing or breaking relationship is very, very important. Social skills in adolescence have to be worked upon. I request Samit sir to continue our skills further. Thank you for this opportunity. Samit sir.
Yeah. So now we understand that what are the different life skill and how this life skill we have to adapt in different ways in our regular day-to-day life with the different methodology. We in next upcoming present webinars, we will actually implement all these life skill in actually our case scenario based examples of our life skill. But at the same time, today we have to understand that these are the social skill that will be teachable, teach each and every moment of the life, and that can be depend on the which stage of the child is. If we want to teach the early adolescent about the different life skill, we have to start with the asking them the specific questions so they can understand what they have to implement. We can ask directly, tell me the three things who you are really proud of. That is the self-awareness. Such type of the question asking will increase their awareness about their own self. During the home environment also, the all the parents has responsibility to go and they have to do at dinner what everyone share is the high and one low from their day, and evaluating her whole day with the thinking about the high and low in a casual conversation will be help teach adolescent that how they can understand their problem, and they can how discuss with the parent in such a way that they can get the some problem if they are there by the parents interaction. In school also we can cultivate such type of the social skill by the providing them a group project that really require true collaboration and the shared responsibility. In the age group of the mid adolescent, we have to directly ask something about what they feel, and we have to ask some specific question that what they are thinking if the parent felt when they happen. And role playing to start a difficult conversation is a goal, and being a practitioner, a medical practitioner, we have to start this practicing role playing where we are interacting in isolation with the children in our clinic. In home, we have to encourage in this age group by the volunteering a community services to broaden their circle, their concern, and their building empathy. We can also go for some established peer mediation program in school to resolve the student conflict, and constructively we will give them a proper liability answer and liability to solve their own problem in their constructive way. In late adolescence, we can directly interact with the what are the actual problem is, and what does the healthy and supportive friendship is there, whether it is really liking or it's a good interpersonal skill that is developed by them by helping the friends during the health problem. In a home, we have to directly discuss the important ending of the relationship in respectful manner. Not only about the how build the relation, but when we want to end something, we have to respectfully give the whole opportunity to other party to understand why we are ending this responsibility and relationship because of the some specific problem without any judgment. In school, we can directly create some mentorship program with NGO and unprivileged school to contribute their social cause. So such type of the activity in late adolescence will build an excellent social life skill in their life. After the understanding of the our two main heading, that is the heart and hand, now it's time to understand the head cluster because it is a main head of everything. So we have to understand that we have to move the youth from passive intuition to the active analysis of the problem, and that is what we have to understand. We having a two type of the thinking skill. One is the lower order thinking, and the other are the higher order thinking. So remembering and understanding of the problem and summarizing the things are considered as lower order thinking. After that, applying, analyzing, evaluating, and creating something inventory will be considered as a higher order thinking. We have to understand the cognitive engine of resilience. A true problem solving and decision making do not happen by accident. They occur require a brain to actively create and evaluate the solution rather than the passively react to stressors. And for that, critical thinking, creative thinking, decision making, and problem solving is really, really important. So we are not here to, we have to understand that we are not here to fix the youth. We are here to build a capable, proactive mind that can navigate the adult system, not built for their special needs. So let's understand the few specifications related to this different skill. So what the critical thinking is the ability to analyze the information and experience in an objective manner. So it helps to recognize and assess the factors that influencing our attitude and behavior, such as the media and peer pressure influence. Contributes to the both decision making and problem solving. Critical thinking is very, very important to go for a developing responsible behavior. So we have to understand, we have to move from intuition to analysis. Means We have to having a W and one edge approach when we are doing any analysis. We have to understand what and who is the source, what is the evidence which will really indicate that this thing problem is there. Then we have to understand where did it happen and what the problem ultimately, whether it is relevant to us or not, and why is really relevant to us in our day-to-day life. And finally, EH is how was the conclusion that what we reach. So this critical thinking we have to cultivate in proper systematic way to understand that they can get the idea about what this different methodology is there. And for that, we have two type of thinking skills are there. One is the fast thinking skill, and another is the another is slow thinking skill. In fast thinking, it is the automotive, emotional prone to bias. But where it is slow thinking, it is the effortful, logical, and calculating. And that's why we have to cultivate such type of the analysis in such a way that any accidentally stressful condition occurs, our brain start understanding what the problem is and how it can be solved in non-judgmental way without any stressors will be continuously affecting our life, but it will be ultimately properly solution that will give a ease of the mind. For that, we have to understand that we have to focus our whole problem, not just like a single part of this elephant, what it is actually depicting. If we not properly critically think about the different aspect of the problem, that ultimately, if we go for a blind spot, like in the figure what showing, if a whole elephant we able to know it is the elephant, but if it will be not like that, uh, we just see the part of the elephant, we can mislead our interpretation. Like if we just touch the leg of the elephant, it looks like a trunk of any tree. If we go for the just the tail of the elephant, it looks like a rope. And if we look to handle the trunk of the elephant, it may look like a snake. But ultimately, we have to understand this is the elephant, means this is the actual problem. It is not a partial problem, and we should not remain such type of the blind person. We also have to bear about the cognitive bias, that including the two type of the bias, that is the confirmation bias and second is the anchoring bias. So what meaning of the confirmation bias? It is means that once we will get the some problem, such type of the thing will coming in our mind, okay, this problem is there. Like if child is thinking, okay, I am having a very difficult paper is going to come, his bias will be confirming that now it will not properly perform properly. Just now we having excellent example of that NEET examination. Many child is thinking that the previous what their performance, this time this performance is not will be good in next upcoming NEET examination. Second, about the anchoring bias, means it is the fixing the first piece of the information what we receive. Means if you just check out the different type of the advertisement where what we are saying, the anything like shoes cost will be the 2,500 in the this today in place of the 5,000, what we are thinking, we are getting the 2,500 rupees discount. But when we properly structurally think that ultimately this actual cost of this shoes is maybe less than 2,000 also. So that is the actual anchoring bias that is directly affecting and anchoring the our own brain, and we are that will be leading to us a proper improper decision making. So here the critical, after the critical thinking, there is a something that is about the creative thinking. We have to think out of the box to give a good alternative that will be really help us to go for a various consequences that will help to remove us in a systematic way that will be structurally remove our own bias, and that will give us the responsible ability and flexibility to the situation on our daily life. Suppose if we just check we having a red ball, what we are thinking, it is helpful for the drawing, for juggling, team building, physio and physics demonstration, teaching colors and teaching counting. But if we think something creatively, there are many other of things that will be helpful of this red color, like identifying the what the color of that the ball, what is the its shape of the ball, the such type of the thing we can having a critically helpful, and we can remove our fixedness in our mind, and this cognitive behavior limiting the object to its traditional use. For the creative thinking, for the innovation, there is a one systematic method of the head. It's a six-head philosophy that including the what white head indicate the what is the actual facts is. In red head, it indicate the what we feel is. Black head indicate the what are the risk of this type of the thinking, and then yellow head indicate what are the different benefit of that fact, and green hat will inculcate our creativity, and lastly the blue hat is the actual process, and that shifting the our fixed mindset that I cannot go to the growth, it's changed to the mindset of I cannot do this yet, means it is always a possibility, and it will be very well depicted in mind map, and creating such type of the mind map of the problem means what are the our feeling, what is the actual fact, what is our feeling, what are the risks and what are the benefit, and this mind mapping will give a structured idea about the some creative thinking that will be discussed in our next upcoming webinar. Moving toward the decision making, so what it means, because adolescent is really find to very difficult to make this decision because they are so much afraid about the wrong decision, because they had never take the some decision because of the continuous observed care of the parents. They most often land up to the confused and end with no decision, and often they agonize over what the adult feel are and minor problem like whether to which where things to be where in school get together, and how can they go to the party with a pimple. This is not only related to a major decision like choice of the life partner. Inability to take a decision or solve a problem lead to a lot of stress and emotional turmoil in life of the adolescent, and that other ultimately adversely affecting the physical health of a child. So, in decision making is the ability to take a specific decision or solve a problem that lead to lot of stress and emotion, and that can be lead or adversely affect a physical health. So, there is a simple thinking tool like 3C's action will be the we have to teach the children. Mean what are the actual challenges and identifying it very clearly define the core problem and obstacle you are facing. Then we have to review the choices like brainstorming the ranging the possible easy solution to the harder multiple solutions. Finally, we have to think for the positive and negative consequences and what the benefits and what is this, and ultimately what we have to do this make a final informed decision of our own problem. And this decision making challenge of 3C will be always helpful to child to understand how they can behave in such type of the problem. One important model, that is the power model, again is very important in consideration of the decision making and problem solving. Here, unlike the problem solving, which is the ongoing process, decision making is considered as an event, a milestone, and every decision carries a permanent consequences. Here we having a what power means. P means the pause and think and stop the momentum to reflect before reacting. Then observe the consequences regarding the short and long term. how it will affect our day-to-day life. Compare pros and cons, that is the way option, and choose the align with your values. Express in a proper channelized systematic way just completed by the Sandeep that communication is the key to express ourselves. And lastly, we have to respect ourselves, and that is the considered as a stand forming up your belief and our own decision. So inability to decide lead to a chronic state, and structured choice should be created and should be systematically implemented. Then coming into the deadly constructivity about the problem in our life, and the process evolve the various steps and clearly identify the problem, explore the available alternative, and decision making the best solution as the problem solving is. Here we have to understand this ideal model means identifying the problem and recognize clearly what the issue is, then define the goal, what the our objective and what is our desirable outcome. Then explore the alternative by the brainstorming and possible solution options. Op- Then we have to act on the best solution and implement the chosen plan. And at the end, we have to look back and learn and evaluate the outcome and learn from the experience. So problem solving is a total ideally five-step model that what we have to implement. So shift from the again reiterating the fixed mindset that I can to growth mindset that is I can't do this yet is a very important when we are dealing with the problem solving and decision making. So as we understand that each adolescent stage has different capability of thinking, and for that we have to understand for early adolescent we have to give them a three choices of three ABCs that challenge, choice, and consequences, and we have to teach them family have to give some brainstorming activity of that family planning. I like the vacation or the some thing that is going to purchase in the family. In school we have to advocate some literacy module like media literacy, evaluate the health advertising claim, and that will help us to improvise that thinking skill in early adolescence. In mid-adolescence, again, we have to teach them the ideal methodology. In our home, we have to give them the pros and cons and analysis of the if such type of the lifestyle change that can occur and what the ultimate opinion of that adolescent that is very much matter. In school, we can initiate a debate club to help the student about the research, express the different perspective of same issue, and this will improve the thinking skill of the mid-adolescent. During the late adolescence, they having a very concrete thinking to the creative and constructive thinking, and they can have change, and that's why we have to use a power model to walk through the important decision and let they should implement their own decision in channelized way. In home, we have to talk to the college and career option, weigh the pros and cons in which the thinking skill will be developed in well manner. In school classroom, we have to promote a problem solving like competitions and entrepreneurship club that what maintain and that help the late adolescent to develop their thinking skill. So now we all understand we must emphasize that life skill enable the teen to ensure that there is no harm occur to themselves and also there is no harm occur to the anyone else, and that's why the life skill is very important. So now we all understand what are the different life skills, how it will be implemented as a head life skill, hand life skill, and heart life skill. But in first slide only, we had just discussed that each life skill is internally related, and everything will be the if properly structurally channelized, then and that it will be helpful us to implement in that. I requesting Dr. Swati Bharat, madam. to give this example and give a conclusion about how this life skill will be helpful to solve the problem. Dr. Swati ma'am.
Thank you, Samir. All three, Sandeep, Prashant, and Samir, have beautifully explained all the 10 life skills. So now this is the last part of the program. I want you to be all very alert now because I'm going to ask questions. This is going to be interaction. And I don't want oral answers. I want you to please put the answers in the chat box. And Samir, Sandeep, and Prashant will see the chat box answers and they will keep saying the answers aloud. So please be ready to put your answers in the chat box. So whenever we are teaching life skills, we taught you separately all the 10 life skills. But in life, we are using them very often together. That means the heart, hand, and the mind very often go together. And Aesop's fables and Panchatantra have a large number of stories which we can use to teach life skills. We all know the story of the tortoise and the hare, the lion and the rabbit, but the commonly one which we use is known as the story of the thirsty crow. And all of you must have remembering the story of this thirsty crow in your childhood when you were in school. So let us go one by one, and I will be putting lines of the story, and then I'll be asking you which life skill or skills were used, and I would want you to put the answers in the chat box. So the first thing was the crow was thirsty. So what life skill has been used in this sentence? Please put it down. Very good.
Self-awareness.
Self-awareness. Yes. Because thirst is a condition in the body and he has to be aware that I'm thirsty. Right. Next slide. He flew around looking for water. So what life skill were used in this action? So self-aware was he was thirsty and then he flew around looking for water. Very good. Critical thinking that yes, since I'm thirsty, I need water. So that was the critical thinking and also some sort of decision making because he has to decide he must fly around to look for water. He also coped up with his emotions. He just sit and say, hi, I'm feeling thirsty, kya karu? He just didn't sit there lamenting. He said, yes, I'm thirsty. So I need to look around for water. I must cope up with my stress and emotions. And he also used his critical thinking that he needs to look for water. And that was the problem solving that I have to quench my thirst. And the decision was that he started looking for water around. So all these life skills came in looking around for water. So now we come to he saw a pot and flew towards it. What life skills would come? He saw a pot and flew towards it. Yes, he saw a pot and flew towards it means now this was again a critical thinking that if I see a pot, there must be water in it because pot contains water. And if I have to drink water, I need to take myself near the pot. That's why he made a decision that critically he decided the pot has water. Then he made a decision that if I have to solve my problem of my thirst, then I have to fly towards the pot. Next. The level was low. His beak could not reach it. He started thinking what to do. He looked around for some stones and started putting them one by one in the pot. So what are the life skills?
Creative
Yes.
thinking. Immediately
Creative
coming.
thinking, but anything more than that? Yeah, critical thinking also, no? Because that was critical thinking. And then because he realized his beak cannot reach, then that is why he decided to use his creative thinking. What can I do if my beak is short and I cannot reach the water? I need to have a creative thinking. And once he had that creative thinking that I need to find stones around the pot and put them into the pot to raise the level, that was the problem solving and decision making. So he used all his thinking skills, that is decision making, problem solving, creative thinking, and critical thinking. Though creative thinking was the most here, all the four skills were necessary to complement his critical thinking or creative thinking. So the water level rose, he could drink to his heart's content, and then he flew away. So what is our skill shown here? So these are all which are put up. So again here, once the water level rose, he could drink to his heart's content. He knew that his thirst has been quenched. That means, am I audible? Has this frozen? Yeah. So our self-awareness, कि now my thirst has been quenched his time. Because after his thirst was quenched, there's no point wasting time just sitting near the pot. So he made a decision कि now since the problem of my thirst has been solved, now I can move for other work, and he made a decision to fly away. Next. So you can see that if you see the art of combination, so deconstructing the thirsty crowd. So very few utilize all skills in conjunction. So when you learn 10 life skills, the true mastery is to use combination of these life skills which are appropriate to the situation. So here the phase 1 was the trigger. The crow recognizes his thirst, so that is self-awareness, identifying the internal and the external barrier. The phase 2 was the filter, objective analysis, that the water is in a pitcher, but his beak is too short to go to the level of the water. So objective analysis, again, critical thinking, the pitcher is too heavy to overturn and it is too thick to break. So I don't have the strength to overturn the pitcher because my beak is very short and I don't have that strength. So then he did critical thinking, analyzing the fact without panic. That means he didn't say, now what can I do? I'm thirsty. I've got this pot, but the water is very low. So he didn't get frustrated or disappointed or angry or sad. He used his critical thinking. And because he used his critical thinking, he started innovating. What if I use the nearby pebbles? What if I use the water level? And that is why, because he started using his critical thinking for problem solving and decision making, he also realized that I need creative thing for this. And that is why he started using his creative thinking. And the last phase was the execution. That means he decides that I will put the pebbles one by one till the level of the water is enough for my beak to reach. He didn't spend time filling half the jar with water, which was waste of his energy. So he decided he'll just put enough pebbles so that when the water rises for the quenching of his thirst, he will not waste further time in adding more and more pebbles. That means this was a decision making and problem solving. He was very focused as to how many pebbles he should put, and also teaching that yes, this is the what I need, this is my focus. I need to quench my thirst and then I need to fly away from there. So you are not just teaching a curriculum when you're teaching life skills, you are architecting human resilience. Next. Next, Sami. Yeah. So whenever you become a life skill trainer, you have to keep upgrading your skills. So this is the pictures which we have shown, that when there was an ancient crow, it was hard work putting pebble by pebble. But a modern crow, if he's near a beach, you know the littering which is done by straws. So this crow now can use a straw to drink water. So you have to keep innovating. So whenever you're using life skills, whatever are the old methods, you have to overcome them and start new methods. Next. So what is life skills? We are from surviving, we are coming to thriving. That is the goal of the life skills. You are not just surviving, but you are doing great thriving. That means if there's an adversity or stress, what do? You first use your hard skills. Because whenever there's adversity or stress, the amygdala kicks in. And you want the prefrontal cortex, that is your thinking brain, to overcome your emotional brain so that you can have rational thinking. So first you have to learn how to cope up with your stress and emotions. So calm down your heart. Once your heart is calmed down, then you start using your thinking skills, which is the problem solving, decision making, critical thinking, and creative thinking. And once you have come to a solution, then you have to do the assertive action. That means now you are going to implement your action, and then you will decide how to implement it. For that, you can use your interpersonal relationship, your communication skills, your empathy, so that you know exactly how to implement the decision which you have reached rationally, not thinking only through your heart, through amygdala hijack, but with your prefrontal cortex, with rationality and judgment. And that ultimately leads to resilience and self-efficacy. So when we say resilience, it is not just bouncing back, because bouncing back is the first step, but you now have to adopt and thrive in a changing environment. And that is what life skills teaches you, how to have positive skills to adopt in a changing environment. So what is the path forward? Whenever you're becoming a life skill trainer, you're not only teaching the adolescents or the children or the parents, but you're imbibing these skills yourself. That means self-awareness, know yourself. We have discussed SWOT analysis in detail. Connect with others, empathy and communication, think clearly, critical and creative filters, act decisively. We have given you ideal and power models, and maintain your emotional balance by emotional and stress regulation. Next slide. So life skills are not a one-time lesson. Skills are acquired through patience and practice. They can be used positively, but the intention to use is the key, and they can transform us from passive observers into active, consistent participants in our own lives. And last 26 years, I've been using life skills to deal with all the problems, adversities in my life. And I find that because of life skills, I'm able to cope up and be positive and happy. So all of you who are going to now become master trainers or who are going to practice life skills, please attend our future webinars, and Samir will give you a guidance as to what your second and third webinar will be. And as the webinars take place, he will keep guiding you for the next webinar. So I hope you all will definitely come for the next webinars every alternate Friday. Samir, can you tell us about the next two webinars or next webinar?
Sure, madam. So we are now considering the our series officially inaugurated from today. So now we having a first and third of the all the month we are going to do, means it will be in the third of the July, 3rd July and 17th July are the two Fridays in which we having a webinar series. This webinar series will be now totally panel discussion based problems, the real time challenge and the problem that is faced by the adolescent. It will be case based discussion of the one or the two cases, that what we can get the idea about from the different people, and we will invite our own trained master trainers who were trained during our physical training or at the Pune, and we having our own past, so see, very senior members also who are also already trained in life skill and doing that practice since long. So with the all the visionary wisdom of them, we will try to solve the practical solution, and that what we can implement in our day-to-day life of the different problem related if such problem occurs. We can guide being a pediatrician, being the adolescent specialist to the our own patient also. We can utilize in our home also. So this is the our main aim and objective of this life skill webinar series. Over to madam.
Thank you, Samir. Sushma and Piali, after this webinar, you both have any comments?
Actually, ma'am, it was so insightful. I mean, it was such a creative way explaining the life skills. And the final stuff, which was explained by you, put a great, it was not just an icing on the cake, but I think that was the crux of entire discussion. And it looks like, it should be learned under you. And this is very, very innovatively and impactfully created module. So we would love to get trained and get it done under HA, ma'am, so that more and more the pediatricians and more the medical practitioners, I would like to say, will be trained because we all need a lot of life skill training for our day-to-day problems to be solved by ourselves, as you very rightly pointed out. Learning life skill makes us kind of resilient in true sense. So, ma'am, it was a very, very insightful discussion, and I think we do look forward to having it in depth. And we will be joining hands, and we will be drafting the stuff soon so that we can propose it to you for your approval. Thank you, ma'am, for making us a part of such a wonderful module, ma'am. Thank you so
Sushma.
much.
The credit of these beautiful slides and modules go to the Aki Trimurti, Samir, Prashant, and Sandeep. They have done a wonderful job for the slides. I really thank them. And Piali, would you like to make any comments?
Ma'am, you've made it so simple. It is so nice.
Thank
When
you.
I got it when I did the Aki course, it is even better than that. This is very nice. Thank you so much, ma'am, for involving us.
Thank you. Sandeep and Prashant, would you like to make some comments?
Yeah. Just that looking forward to our coming sessions because practical case holding will give a newer perspective even for us to how to apply in clinical practice. Thank you.
Thank you, Sandeep. Prashant? Prashant is there or he's...
Now, yes, Prasad is there. Yes, Prashant.
Okay, so we now look forward. Samir will be making flyers for the next webinar, and he's doing the same thing, the Zoom link, etc. And in the meantime, Samir, Sushma Ben, Shamik, and Piali, you do all the details with Sandeep and Prashant also, how to take this forward with AHA. And when you all have finalized the document, then I just come and have a look. But I have full faith that all six of you will do a wonderful roadmap, and I'm sure I will have very little to add. So you six
Oh,
can now
sure,
work
sure,
together
ma'am.
and
Yeah.
make a road plan.
It's a pleasure having Prashant and Dr. Sandeep ji also, and we'll definitely make it as soon as possible. I think in the next week, early next week, which we have planned, right, Sami bhai? So we'll have to plan a meeting with Prashant, Sandeep, Shamik ji, and Pali, myself and yourself, and then we will be planning it as soon as possible so that we can start working on it, and we can take the maximum advantage of the Aki celebration week. Yeah, sure, ma'am. Thank you so much, ma'am.
Sushma, let's go ahead with this. It's beautiful.
Yeah, yeah, ma'am. Thank you.
Always a pleasure to work with AHA, and with AHA, we'll go forward with a bang now. Let's take LSC all over.
Ma'am, your blessings are there, and your support and your presence a lot of difference, ma'am. Thank you so much.
Okay. So, Samir, you can wind up.
Yeah, so looking forward the good collaboration from the not only from the AHF but the all the participants who are present today. Just try to work for the this preventive precision of the life skill approach in your day-to-day practice, in your own life, for your own patient's guidance, and do as maximum activity as possible, at least between the 17th to 24th July. That is what we are going to celebrate as a Aki week, and let's join hand with each other and make the life easy for the our own resilient adolescent. Thank you. Thanks a lot for joining today. And
Commodore Parnaik, are you there? We have a Commodore Parnaik. He's a retired person from the Navy, and he has also joined us. He does a lot of adolescent work. Is he still there or gone? Yeah, I'll take a feedback from him afterwards. This is the first time he's attending life skills. Okay. And anybody else has 2 minutes of conversation? Any comments to make? Poonam
now,
Bhatia?
yes, now the forum is open for the discussion. Any comments, any query? Just we having a few minutes more, and then we can wind up.
Aryan Sharma?
Sir is traveling, but he is listening.
Acha, Poonam Bhatia?
Yes, ma'am, the slides were excellent. And I think the last slide where you summarized the whole presentation, like what a child should do or what a person should do in crisis or in adversity. I think I need to make a poster out of it and paste it in my clinic. That is a wonderful slide. Yes, like adversity and stress, then regulating your emotions, then clear thinking. It is excellent slide. Whosoever has made it, he has made it.
As I said, these slides were Samir, Prashant, and Sandeep.
Yes, very,
So I
very
will give the
clear.
due credit for the
Very
slides
clear
to them.
slides. Yes.
We took some material from our old modules, but a
Yes.
lot of it is also new. So
Thank you, ma'am.
yeah. Anybody else wants to make a comment?
Good evening, ma'am, and everyone. Ma'am, my name is Pooja. Ma'am, the last slide, as truly said, when you spoke about the resilience, we always think that it's just about bouncing back, but it's basically adapting and thriving to the new environment and the real world which is there. So that was a really nice insight. Thank you very much, ma'am. And thank you for these beautiful slides and the way you explained it. It was really, really nice. Look forward to the other webinars also, ma'am. Thank you.
Thank you. So last two comments, then we'll wind up. It's already late. Okay. Samir, I think everybody has
Yeah,
made
so
comments.
let's move forward towards the our next webinar on the third and then 17th, because that is the our first day of the Aki week celebration. So we can having a more interactive sessions with such type of the activity and be connected with the Aki, because the Aki is known for the such type of the innovative activity, and we definitely encourage the not only about the learning experience only us, but the do the social work through the help of such module in community at school level at or the whatever the level possible for you. Let's make it and have a great weekend. Thank you. So we can conclude, ma'am.
Yeah. Good night, everyone.